I'm so glad you've joined us for this next topic. We're talking about incontinence post-pregnancy. Now, it might be something that we laugh about with our girlfriends, but it happens, and...
It's often not talked about it either.
Yeah.
So, but it's good to talk about it. So, firstly, it happens. Let's explain. So, you know, when a baby comes out of your vagina, it stretches your pelvic floor muscles in a way they aren't normally stretched.
Yes.
And sometimes those pelvic floor muscles, they are important for maintaining your bladder control. So what can you do beforehand and what can you do afterwards to sort of help reduce the risk from this from happening? So firstly, it's good to do pelvic floor exercises. And it's not like something you just do for like a couple of days and then it's all right for the rest of your life.
Right.
Pelvic floor exercises are like a commitment for life.
Okay.
And you should be doing them all the time.
It's like brushing your teeth.
Pretty much, that's right. So what are pelvic floor exercises? Now, as a trial, what you should do is when you're sitting on the toilet and the urine's coming out of you, try and stop the urine from flowing.
Right.
And if you can do that, that's contracting your pelvic floor muscles, and that's really good.
That's how you know that's the muscles that you should be using.
Exactly
and
right.
You don't do this all the time on the toilet because you might get a UTI.
Correct. So I was going to get there, but you beat me to it, which is good.
Right.
So don't do that as the exercise. That's like the test. Maybe once every 6 months you just do to make sure you actually can do it. And not everybody can actually stop the flow of urine, but if you can actually get your head around which muscles to contract, that's really important. If you're really having trouble working it out, you can see a pelvic floor physio, and there's a bunch of them around who are specialised in helping you with these exercises. So, firstly, work out what muscles you need to contract. Next, this is what a normal set of exercises includes. You do 10 quick ones. I'm going to just imagine my hands are pelvic floor muscles, right? So you do 10 where you go squeeze, relax, 10 of those. Then you have a break. Then you do 5 where you hold it for 10 seconds.
Right.
And then you relax for 10 seconds, right? Okay. So the whole thing takes a couple of minutes, right? And
we can do them right now.
That's right. No one knows when you're doing them. You can do them anytime, right? So you need to develop a habit of doing them regularly. And so you're going to set up some little cues for you. Like if you watch a lot of TV, when the commercials come on.
Or even at the traffic lights.
Traffic lights.
So these help.
There's just things to just like fill in the time, but do it regularly and become this regular habit.
So what if you have this problem? What if you have this problem? What can you do?
So firstly, go and see a pelvic floor physio. Right. So firstly, we're going to talk about just with labour, right? So when the birth happens, often afterwards, there is some leakage for a couple of weeks while your bladder's kind of recovering from the process.
So this can be expected.
That's right. The part of your bladder that senses when the bladder is full, that gets really stretched when your cervix dilates. And so as it comes back, it just takes a while for it to recover because it's been a bit of a shock to it. So after a few weeks, things are normally returning to normal. Right. Regular pelvic floor exercises after the baby's born, same sort of process as we talked about, same set of exercises, do them regularly. If you're still having problems long term, you need to go and see a pelvic floor physio to help you. And there are very rare that you might need some, other type of intervention to help with this. But it's a very common problem. Yeah. It's not often talked about in our society because it's kind of a bit embarrassing.
Well, us girls laugh about it. So thank you so much, Dr. Wood, for those tips, and I hope that's helped you. Keep it locked right here at Mums at the Table.